হ্যালো মাই ডিয়ার ফ্রেন্ডস, ওয়েলকাম টু নার্সেস ভয়েস চ্যানেল। আমরা আগের ভিডিওতে চাইল্ড হেলথ নার্সিংয়ের উপর অ্যাপ্লাই কোয়েশ্চেন অ্যান্সার দেখে নিয়েছি। আজও আমরা চাইল্ড হেলথ নার্সিংয়ের উপর কোয়েশ্চেন্স দেখব। চাইল্ড হেলথের উপর যেহেতু অনেক কোয়েশ্চেন্স, তাই কভার করার জন্যই আমরা বেশি করে কোয়েশ্চেন প্র্যাকটিস করব। তো চলো বন্ধুরা, আমরা আজকের কোয়েশ্চেন অ্যান্সার মডেল 2B দেখে নিই। এবং এখনও পর্যন্ত যারা চ্যানেলকে সাবস্ক্রাইব করোনি তারা অবশ্যই চ্যানেলকে সাবস্ক্রাইব করে বেল বাটন দিয়ে দাও এবং পরবর্তী ভিডিওগুলি দেখতে থাকো। আমাদের আজকের ফার্স্ট কোয়েশ্চেন হলো, নার্স ওয়াজ এডুকেটিং প্যারেন্টস অফ এ চাইল্ড উইথ নিউলি ডায়াগনোসড অ্যাটেনশন ডেফিসিট হাইপারঅ্যাক্টিভিটি ডিসঅর্ডার ADHD. All among the following are features of ADHD except option A, difficulty paying attention, being overactive, acting without thinking, or option D, excessive fatigue. And here the right answer is option D, excessive fatigue. ADHD is a mental condition in which child has differences in brain development and brain activity that affect attention and the ability to seek skill and self-control. Except option D, all other options are the characteristics of ADHD. Second question, nurse was collecting history from a child's parent who is scheduled for IPV vaccination. Which among the following informations nurse brought into the attention of doctor? Recent history of upper respiratory tract, anaphylaxis reaction to neomycin, redness and itching at previous injection site, or option D, child is having diarrhea. IPV vaccination means injectable polio vaccine. And here the right answer is option B, anaphylaxis reaction to neomycin. Anaphylaxis reaction to neomycin should brought into the attention of doctor as IPV contains trace amount of streptomycin, neomycin and polymyxin. Next question, OPK nurses noticed one of the childs with a crusty yellow honey colored scab from over the sore on the face of a child. She should understand that the condition is scabies, impetigo, psoriasis, or option D, dermatitis. And here the right answer is option B, impetigo. Impetigo is a skin infection caused by group A Streptococcus or Staphylococcus aureus. Crusty yellow or honey colored scab from over the sore, which then heals without leaving a scar, is the characteristic lesion of impetigo. Scabies is a skin condition caused by a tiny browning and mite called Sarcoptes scabi, and the condition is characterized by intense itching and the urge to scratch may be especially strong at night. Psoriasis is a non-contagious chronic skin disease that produces plaque of thickened scaly skin. The dry flakes of silvery white skin scales result from the excessively rapid proliferation of skin cells. Dermatitis or eczema is the inflammation of the skin typically characterized by itchiness, redness and a rash. Next question, nurse was educating parents about febrile seizure. Nurse understands the further teaching is needed if parents selected which among the following as the characteristics of febrile seizure. It can be prevented by giving paracetamol syrup when child falls sick with fever. It does not cause brain damage. Anti-seizure medications may need to continue for a couple of years, and children usually outgrow this kind of seizure around 6 years. And here the right answer is option C. Anti-seizure medications may need to continue for a couple of years. All options except C are correct about febrile seizure. Usually anti-seizure medications are not needed to manage the febrile seizure as they tend to last less than 5 minutes. Next question, mother of a child diagnosed with phenylketonuria asked the nurse regarding her diet. What type of diet nurse should advise the mother? Low protein, low fat, low calorie or high fiber? And here the right answer is option A, low protein. Phenylketonuria PKU is caused by deficient activity of the enzyme phenylalanine hydroxylase needed to convert the essential amino acid phenylalanine to tyrosine. Phenylalanine is an amino acid found in protein, so the child should be encouraged to have low protein diet. Next question. Nurse Julie was attending a 1-year child on the first post-operative day of chiloplasty. Which among the following restraint she should prepare for the child? Mummy restraint, jacket restraint, elbow restraint or hand restraint? And here the right answer is option C, elbow restraint. Elbow restraint is used around the elbow to prevent from bending the arm. In this situation, we need to prevent the child from bending arm so that he cannot access the repaired lip. All the other given restraints are not suited with the given situation. Next question. Nurse received a call from emergency that a new admission of child with meningococcal meningitis is going to be there in her ward. What all are the pre-admission requisites she needs to do? Arrange oxygen supply, ready with the emergency medicine and incubation system, arrange isolation with droplet precaution, or option D, get ready with ICP lowering agent. And here the right answer is option C, arrange isolation with droplet precaution. A child with meningococcal meningitis should be placed on droplet precaution until they have completed 24 hours of appropriate antibiotic therapy. Oxygen supply and incubation arrangements are based on sickness level of child. There was no communication from emergency department regarding any special arrangements. Next question. A child with sickle cell disease started on oral deferoxamine therapy. While initiating this therapy, what sign or symptom should the client report immediately? Red color urine, itching, diarrhea or hearing changes? And here the right answer is option D, hearing changes. All above the following are the side effects of deferoxamine, but the serious side effect which needs immediate attention from the medical practitioner is vision changes, such as vision loss, loss of color vision, cataract, eye pain or hearing changes, decrease the hearing loss. Next question. Nurse Julie is assessing a child with chickenpox and she noticed papules, vesicles and crust in her body. How will she document these findings? Pleomorphism, Koplik spot, blotchy rash or sandpaper rash? And here the right answer is option A, pleomorphism. A characteristic feature of the rash in chickenpox is pleomorphism, which means all stages of rash, papules, vesicles and crust may be seen simultaneously at one time in the same area. This is due to the rash appearing in successive crops for 4 to 5 days in the same area. Koplik spots are the peculiar spot present on the buccal mucosa and are considered a diagnostic or pathognomic feature of measles or rubella in the pre-eruptive stage. A rash is the most common sign of scarlet fever in both adults and children. It usually begins as a red blotchy rash and becomes fine and rough like sandpaper. And the last question is, doctor ordered visual acuity test for 1-year-old child. Which among the following nurse need to prepare for visual acuity check? Any object which child needs to look and follow? Snellen chart, symbol chart or all of the above? And here the right answer is option A, any object which child need to look and follow. 1-year-old child is not able to understand symbol chart or Snellen chart. In order to assess visual acuity in them, nurse needs to hold any object in child's visual field and needs to check whether the child is able to follow the object or not. তো বন্ধুরা এই ছিল আমাদের আজকের ভিডিও ভালো লাগলে অবশ্যই লাইক কমেন্ট এন্ড শেয়ার করো এন্ড থ্যাংক ইউ ফর ওয়াচিং দিস ভিডিও।